Hi everyone, welcome back to another episode of Psychiatry Rewritten. My name is Lane. Okay, so picture this. You've had this weird chest tightness for weeks, or your stomach is acting up again, or maybe your hands keep tingling randomly and always at the worst time. You go to the doctor, you do everything right, the blood work, the scan, the specialist, the follow-up, and then you get hit with that sentence. Everything looks normal. And part of you wants to be relieved, right? But the other part feels kind of invisible because it still hurts. You're still exhausted. You still know something isn't right. But now it feels like no one believes you. So that's what we're talking about today. That feeling. When the body's screaming, but the system says you're fine. That moment where pain becomes isolating instead of clarifying. That thing we call somatization. And let me just say this clearly at the start. Somatization is not made up. It is not faking. And it is not attention seeking. It's your body speaking, just in a different dialect than most of us were ever taught to understand. So here's the real definition, and I'll keep it in plain language. Somatization is when emotional distress like anxiety, trauma, grief, or even fear starts to express itself physically. Not because you want it to, not because you're imagining it, but because your nervous system is overwhelmed. And it's using your body to carry the load. Some of the most common symptoms people experience are GI issues like nausea, cramps, bloating. Some people experience headaches and migraines, or muscle pain, or joint stiffness, chest tightness, dizziness, shortness of breath, numbness or tingling, extreme fatigue like crash on the couch for hours, kind of tired. And usually, the medical workup doesn't give a clear answer. So people either get bounced from specialist to specialist, or they get labeled with things like just anxiety, nothing to worry about. Or worse, maybe talk to someone about it, which is code for it's in your head. But here's the truth that doesn't get said enough. Your body isn't betraying you. It's doing exactly what it was trained to do, especially If you've ever had to suppress emotions just to survive, if you've grown up with trauma, chronic stress, or had to push down how you really feel, your body learns to carry what your mind can't. It's not weakness, it's adaptation, it's survival in physical form. And before we go further, let me make one more distinction. Somatization is not the same as conversion disorder, where someone might lose the ability to speak, move, or see with no clear physical cause. That's a very specific type of neurological symptom response. It's also not malingering. That's when someone knowingly fakes symptoms for gain. That's rare, and it's not what we're talking about here. And it's not hypochondria, which, by the way, the DSM doesn't even use anymore. The newer term is somatic symptom disorder, and even that diagnosis gets misunderstood a lot. So, if you've ever felt like your body was falling apart, but no one could find a reason for it, or if you've ever felt gaslit by medicine because your pain didn't come with a diagnostic code, you're not broken. You're not dramatic. You're not imagining it. You are living in a body that's doing its best to speak, even if it doesn't use words. Coming up, I want to talk about what this feels like from the inside, the medical gaslight, and what actually might be happening in the nervous system when no one else can find the pain, but you still feel it every single day. Okay, let's talk about what happens when you finally get brave enough to ask for help and the system tells you you're fine. You walk into the clinic or the ER with pain you can't explain. You've Googled, you've waited it out, you've told yourself maybe it's nothing, but it's still there, gnawing, throbbing, lingering. So you go in and they start with the basics, right? Vitals, blood work, maybe imaging, CT, X-ray, ultrasound. Then the doctor walks back in without much eye contact and says something like, your tests all look fine. There's nothing physically wrong. And it sounds like it should be good news. But it feels like a slap in the face. Because what they just said is, you're not sick enough for us to care. Or worse, we don't believe you. That moment, that gap between your lived experience and their clinical summary, that's the medical gaslight. It's when your body is screaming and someone hands you a pamphlet about anxiety and tells you to try yoga. Now, don't get me wrong. Anxiety can absolutely cause physical symptoms. But the problem isn't that providers mention anxiety. The problem is they often stop there. They don't ask what kind of anxiety or how long it's been there, or if maybe the anxiety itself is trauma in disguise. They just want the symptoms to fit the test results. And when they don't, you get blamed. This happens all the time, especially to women, people of color, neurodivergent individuals, and anyone with a history of a mental health diagnosis. Because once a chart says depression or bipolar disorder or panic disorder or somatic complaints or any of the other diagnoses that you can think of, it becomes the only lens they see you through. I've had patients and friends and myself who were told for years that their pain was stress related, only to find out later it was endometriosis or Lyme or an autoimmune condition that didn't show up on early labs. And by then, they'd been through dozens of appointments. Some had even started to believe the lie that it was all in their head. But here's what I want to say, especially if you've lived this. Pain is real, even if no one else can see it. And being gaslit by the medical system doesn't mean you're crazy. It means the system doesn't know how to listen. So, next up, I want to share a short story. One that captures what this experience actually feels like from the inside. Because when we reduce everything to labs and imaging, we miss the human being sitting in front of us, trying to make sense of pain that never got a name. We keep missing each other. I started going to the ER after the third night in a row. I couldn't breathe. My chest felt tight, like a hand was pressing down on it. My fingers would go numb. My heart would race. I was sure I was dying. They said it was anxiety, but it didn't feel like anxiety. It felt like drowning quietly in a room full of people who kept calling it a panic attack. She was in room 6 again. Third time this month. Chest pain, shortness of breath, tingling, dizziness, same pattern. Night shift. Her EKG was fine. her labs were clean, perfect, better than mine, better than yours. I knew she'd probably be back next week. And still, I couldn't bring myself to roll my eyes like some of the others did, because I could see it in her face. I could see it in her eyes. This wasn't attention seeking. This was someone who had no other place to go, and a body that was screaming for help in the only language it knew. I started hating myself every time I went back. I could feel the nurses sigh when they saw my name. I didn't want to be that patient, the one with nothing really wrong, the frequent flyer. But it didn't matter because my body wasn't listening to logic. It just knew it was scared. It just knew it hurt. And it didn't know how else to say it. I wanted to ask about trauma and panic about who taught her that suffering had to look like a heart attack to count. But we had 6 more patients in the waiting room and 10 more in the hall, and she wasn't dying, at least not in a way I could chart in Epic. The worst part wasn't the pain. It was the moment I started to doubt myself. Maybe I am just crazy. Maybe I am wasting their time. But somewhere inside me, the part I stopped listening to years ago, I knew it wasn't fake. I knew I needed help. I knew my quality of life, but the people around me were suffering. I just didn't know how to ask for it without a blood pressure cuff and a gown. I still think about her sometimes. I wish I had said, you're not making this up. I wish we had better tools. I wish she didn't have to get sick to be seen. And God, I wish I'd had more time. I wasn't faking it. I didn't think you were. I was in pain. And I believed you. I just didn't know where else to go. And I didn't know how else to help. And we just kept missing each other. But maybe next time we won't. So yeah, the pain is real, even when the scan is clear, even when it looks perfect. And your body isn't failing you, it's talking to you. The real question is, are we listening? Let's go a little deeper here, because this isn't just a patient issue. It's a training issue, a diagnostic issue, a systems issue. When someone comes in with physical symptoms, but nothing shows up on tests, our job isn't to prove them wrong. It's to ask what their nervous system might be trying to say. Help them become more in tune. Somatic symptoms aren't less real, they're just less visible. And sometimes believing the patient is the most therapeutic thing we can do. Simple. Let's do a Mythbusters. So the myth is if it doesn't show up on labs, it's not real. The truth is lab tests only measure what we know how to test, right? They can't detect trauma. They can't measure grief. They can't scan for invisible wounds. So when we say it's just anxiety, what we're really saying is, I can't explain it. And that's not the same as it not being real. Here's what we don't talk about enough. Over 75% of visits to primary care involve physical symptoms with no clear medical explanation. In most med schools, they give students less than 5 total hours on how to manage somatic symptom disorders or trauma-informed care. So maybe the problem isn't the patient's pain. Maybe the problem is how we've been trained to ignore it. Up next, we are talking about what happens when the system gets it wrong and what it looks like when somatization overlaps with autoimmune conditions, fibromyalgia, or trauma that got misdiagnosed as something else entirely. Because there's a big difference between not finding anything wrong and not knowing what to look for. So here's where it gets messy. Because even when the system does believe that something's going on, right? It doesn't always know what it's looking at. And that's how so many people, especially women, neurodivergent individuals, trauma survivors, and people of color end up stuck in what I call the diagnostic trap. You bounce from doctor to doctor. Each one runs the same test. Each one gives you a new maybe diagnosis. It could be fibromyalgia. Maybe it's autoimmune. Have you seen a GI specialist? Or my personal favorite, you should probably talk to someone about your anxiety. And the truth is, sometimes they're not wrong, but they're also not going about it the correct way, and they're also not getting the full picture. Because what most systems don't understand is this: you can have real physical illness and unresolved trauma. Duality exists. You can meet criteria for IBS and still be grieving something that never got words. You can be inflamed and exhausted and scared. And it's not in your head, it's in your history. It's ingrained in your patterns and in your behavior. Here's something that rarely gets taught in medical school. A study published in Psychosomatic Medicine found that patients with a history of childhood trauma are 2 to 3 times more likely to develop medically unexplained symptoms in adulthood. Not only that, but people with trauma often score higher on symptom checklists for things like chronic fatigue, irritable bowel, dizziness, migraines. And guess what? They're also more likely to be misdiagnosed with psychiatric illness instead of being taken seriously by specialists. This is where we have to stop pretending that the body and the mind are separate files. Because the longer we keep trying to split them, the more people fall through the cracks. Think about it. Someone with dysautonomia might get told it's a panic disorder. Someone with somatic trauma might get misdiagnosed with fibromyalgia. Someone with trauma-induced flare-ups might get labeled as difficult or non-compliant when the treatment plan doesn't help. It's not helping. Let's do a little myth buster moment. Relax a little bit. It's intense in here. The myth: if it's somatic, it's just psychological. The truth is somatic symptoms can be rooted in complex nervous system dysregulation, trauma responses, and even inflammatory processes, none of which are imaginary. Psychological doesn't mean fake. It means the symptom lives somewhere between the cells and the stories we carry. I've seen patients who were told for years that their fatigue was laziness, only to be diagnosed with post-viral POTS after COVID. I've worked with women who were told it was just hormones, when what they actually had was untreated CPTSD and cycle-related mood dysregulation that mimicked bipolar. And I've had patients referred to me for health anxiety, only to realize they'd been in a state of physiological hyperarousal for so long that, of course, their body felt broken. If someone says their body feels off, believe them. If their story doesn't match your textbook, get a new book. And if you don't know what it is, say that. But don't say it's nothing. Because the human body has more stories to tell than we've learned how to hear. So, what happens when you finally get a diagnosis, but it doesn't explain everything? or when the label makes you feel even more trapped. That's where we're heading next, because the right diagnosis can be a relief, but the wrong one, that can be a whole new kind of pain. When we talk about somatization, people usually think we mean something vague, like stress headaches or feeling a little off. But for some of us, the pain was never vague. It was daily, specific, and it shaped everything. I used to miss school constantly because of abdominal pain. Every single year, I'd get in trouble for truancy. My parents would receive letters in the mail, and I wasn't trying to skip. I was in pain. I'd wake up with stomach cramps, sometimes even nausea, a lot of the time nausea, and feel sick before I even got in the car to go to school. It happened so often, it became this weird part of my identity. Like, I just had these GI issues and my stomach just always hurt. But no one ever asked if maybe I didn't feel safe or if there was something that I was worried about. No one ever said, hey, is something going on in your world that's making your body talk louder than you can? My dad, who meant well because he knew what was going on, would tell me it was somatization. He'd say I was just anxious. And I was. But I didn't know what anxiety felt like back then. I only knew what stomach pain felt like. And my dad was the one that tried to help me, start identifying that anxious feeling and that stomach pain and the association there. But it was exhausting, and even after I became aware of what it was, it still took a long time and a lot of work and effort for me to, kind of get a grip on it. That's the thing about somatization. It's not weakness. It's the brain and body doing their best to translate a feeling you weren't allowed to say out loud. And when those feelings don't get acknowledged, they don't disappear. They just tunnel, they go underground. They go into your gut, your muscles, your back, your neck, your breath. This is what some researchers call body memory. When your nervous system holds on to pain, fear, or shame and expresses it physically, especially when it doesn't feel safe enough to process it through words or logic. It's not conscious. You're not faking it. But your body is still trying to complete something. A stress response that got frozen in place. That's also why trauma survivors often have chronic symptoms, even if they can't remember the trauma in a clear or vivid way. The body remembers, even when the brain tries to forget. A little quick brain science drop. The insula, the part of your brain that monitors internal signals like pain, heartbeat, hunger, is often hyperactive in people with somatic symptom disorders. And in people with PTSD or high stress, the brain literally changes how it processes bodily signals, often interpreting safe cues as dangerous ones. This means your body starts reacting as if something is wrong, even when you're just trying to sit in class or chill or go to work or make it through your day. So when we say the pain is psychological, that doesn't mean imaginary. Okay, it means the pain has roots, and those roots go deeper than the MRI can reach. In the next segment, we're going to talk about what healing actually looks like. And spoiler alert, it doesn't always mean the symptoms go away completely, but it does mean the story gets clearer. The shame gets quieter. And sometimes you finally get to feel safe inside your own body again. Some people experience somatization as pain. Others, it shows up as paralysis, seizures, or vision loss. That's called conversion disorder, and it's a real trauma-linked condition that we've misunderstood for decades. The myth? That it's fake. The truth? It's the body trying to shut down before it shuts down completely. So, by now, maybe you're starting to see it. The body speaks in 100 different ways. Pain, fatigue, stomach issues, shortness of breath, chest pain, all of that can be somatization. But for some people, the body speaks even louder. That's when we see something called conversion disorder or functional neurological symptom disorder. It can look like seizures that aren't epileptic, temporary paralysis, loss of speech, tremors, sudden blindness, all very real, all incredibly distressing. And still, the scans come back normal. But here's the thing. It's not faked. It's not exaggerated. It's the body shutting down when there's no other way to survive. When you are on absolute overload, overdrive. In fact, up to 75% of people with conversion symptoms have a history of trauma, abuse, or overwhelming life stress. So again, not fake, just misread. And that brings us to healing. Because a lot of people assume that once you name the problem, the symptoms should just go away. But it's not that simple. the goal isn't always to make the pain vanish. Sometimes the goal is to make it make sense. Healing from somatization doesn't usually look like a single breakthrough epiphany moment. It looks like finally understanding the connection between your stomach and your fear, or your stomach and your worries. Finally realizing your fatigue is grief that your body carried for years. Or finally having someone say, I believe you, and mean it. Treatments that help, they're not magic pills. They're trauma-informed, body-aware, and focused on safety. Things like somatic experiencing, internal family systems, EMDR, pain reprocessing therapy, emotional awareness and expression therapy, even gentle, compassionate CBT when it's done right. And sometimes it starts with the simplest thing, just being believed. Because when no one believes your pain, it multiplies. But when someone listens to it without trying to fix or dismiss it, the body starts to exhale. It starts to learn that maybe it doesn't have to scream anymore. In our final segment, we'll wrap this up with a reflection on what it means to be seen. Not just as a symptom, but as a whole person. Because you were never faking it. Your body was just trying to keep your story alive. I used to think I was just crazy. I had pain that moved from my stomach to my chest, to my back, to my head. Every few months, it would show up somewhere new. I saw cardiology, neurology, GI, nothing. They ran every test. I had 3 endoscopies before I turned 30. And every time they said, everything looks fine, I felt a little more crazy. But it didn't feel fine. It felt like I was falling apart, one symptom at a time. It wasn't until someone finally said the word somatization without judgment that things started to click. She asked me about stress, about childhood, about the parts of my life that never got named. And suddenly, it all made sense. My body wasn't betraying me. It was protecting me. It was carrying emotions I didn't have words for yet. I'm still healing. Some days, the pain is there. But now, I know what it's trying to say. And that changed everything. One of the most powerful things I've learned as a clinician and as a human is that naming what you're feeling can change how it feels. When you learn to identify your symptoms, when you start to notice what happens right before the chest tightness or the nausea or the fatigue, you begin to take your power back. Because now it's not just a random stomach ache. It's, oh, I felt dismissed in that meeting and I didn't say anything. It's, I've been holding it together for days and my body is asking me to stop pretending. It's, I never learned how to cry, so my body did it for me. That's the thing about somatization, right? It's not the end of the story. It's the beginning of a different kind of conversation. A conversation between your body and your mind. One that was happening all along, but no one taught you how to hear it. And maybe for a while, the pain was the only way your body knew how to ask for help. But now, you're learning to listen sooner. You're learning the difference between hunger and grief, between fatigue and overstimulation, between I'm sick and I'm scared. And that matters. Because awareness doesn't make it disappear. But it does make it more livable. And sometimes that's enough to break the cycle. Your body was never the enemy. It was just trying to speak for the parts of you that never got a voice. If this episode resonated with you, share it with someone who's ever been told it's all in your head. Or someone who's still waiting for a name that explains what they've always known. It hurts. And no one can find it until now. Thanks for being here. We'll see you next time.